Pick a bronze plan over silver, have one bad health year, and you can easily pay $5,000 to $10,000 more out of pocket for the exact same covered benefits, according to healthcare.gov and health markets. That is not a premium difference. That is the cost-sharing design working against you. I read the fine print so you don't have to. And the reason bronze looks cheap but bills you more comes down to one number most people never check. In 2026, the ACA maximum out-of-pocket limit for an individual is $10,600 regardless of whether you're on bronze or silver, as reported by health markets. That sounds like a level playing field, but it isn't. Because bronze is built to make you pay roughly 40% of every bill, while silver pays about 70% and leaves you at 30% per healthcare.gov. So you march toward that same $10,600 ceiling far faster on bronze, paying a bigger share of every single claim along the way, which is exactly how the cheaper plan quietly becomes the expensive one. Here's the at-a-glance picture. Silver plans pay about 70% of the average enrollee's costs and sit in the middle on premiums, but critically, they can unlock extra federal savings, according to healthcare.gov. Bronze wins on one thing only: the lowest monthly premium, while carrying the highest deductibles and paying just 60% of costs, per health markets. Everything after this slide is about whether that premium saving survives contact with actual medical bills. Silver is the middle tier, and it's built for the person who knows they'll actually use their insurance. A few specialist visits, some imaging, maybe a minor procedure. The plan is designed to pay about 70% of the average enrollee's medical costs, leaving you responsible for roughly 30%, according to healthcare.gov. You'll pay a higher premium than bronze every month, but the trade is that when you swipe your insurance card, far less of the bill lands on you. This is the part almost nobody understands, and it's the single biggest reason silver crushes bronze for many people. The federal marketplace only applies cost-sharing reductions, extra subsidies that slash deductibles and coinsurance, to silver plans, and healthcare.gov states these can raise a plan's effective coverage to between 73% and 96%, dropping your share of costs to as little as 6% to 27%. On a $12,000 year, a mid-range 87% CSR silver would cost you about $1,560 versus $4,800 on bronze, a $3,240 swing in a single year, driven purely by the higher actuarial value per healthcare.gov and health markets. Silver isn't free of downsides. You pay a higher premium every month than you would on bronze, and if your income is too high to qualify for cost-sharing reductions, the advantage narrows to the plain 70% versus 60% actuarial value gap, per healthcare.gov. For someone who genuinely never sees a doctor, those extra premium dollars can outrun the cost-sharing benefit, which is the one scenario where bronze can legitimately win. Bronze exists for a specific person, someone who wants the lowest possible monthly premium and rarely, if ever, uses care. The plan is designed to pay only about 60% of the average enrollee's costs, leaving you at roughly 40%, and it carries the highest deductibles of any metal tier, according to health markets. If you're young, healthy, cash-tight, and don't qualify for CSR, it's defensible. But that's a narrower group than the people who default to it just because the sticker price is lowest. Give bronze its due, the advantage is real. It offers the lowest monthly premium in the marketplace, while still covering the exact same essential health benefits as silver, and it shares the identical $10,600 individual out-of-pocket ceiling for 2026, as reported by health markets. So in a truly catastrophic year, your worst case is capped at the same number as silver. The catch is everything that happens before you hit that cap. Here's bronze's fatal flaw. It does not qualify for cost-sharing reductions at all, ever, according to healthcare.gov. So a qualifying income enrollee who picks bronze leaves the entire CSR benefit on the table, worth around $3,240 in a single high-usage year, versus an 87% CSR silver, per healthcare.gov and health markets. On top of that, HSA for America notes, bronze deductibles can sit up near the annual out-of-pocket maximum, around $9,250 for an individual in 2024, so you're exposed to nearly the full bill before the plan meaningfully kicks in. Let's put the numbers side by side. Bronze wins the premium round. It's the cheapest monthly cost, full stop. But silver takes the next three. It pays about 70% of costs versus bronze's 60%, leaves you carrying roughly 30% versus 40%, and comes with moderate deductibles instead of bronze's category highest, all per healthcare.gov and health markets. On the criteria that hit you when you're actually sick, silver is sweeping. On coverage, silver's lead widens. Only silver is eligible for cost-sharing reductions. Bronze is locked out entirely per healthcare.gov. Both share the same $10,600 individual cap for 2026, so that rounds a tie, according to health markets. But model a real bad year of $12,000 in claims, and bronze costs about $4,800, while an 87% CSR silver costs roughly $1,560. Silver isn't just winning, it's winning by thousands. Add up the rounds and it isn't close. Silver takes actuarial value, your cost share, deductibles, CSR eligibility, and the total bill in a bad year, 6 rounds. While bronze wins exactly 1, the monthly premium. If this is useful, subscribe. The next breakdown is already coming. The 1-round bronze wins matters only for a specific, narrow type of person. And that's what the next number decides. Before I get to the final verdict, which is the most counterintuitive piece of this, here's the single number that decides it for most people. If you realistically expect more than about $3,000 to $5,000 of medical care in a year, a plan where your share is 30% or less, standard silver or CSR silver generally beats bronze on total cost, according to healthcare.gov and health markets. Below that usage line, bronze's premium saving can survive. Above it, the cost-sharing gap eats the premium saving alive. So who actually wins? For most people, and this is general information, not personal advice, so check the plan summary of benefits and your own situation. Silver is the better fit. If you qualify for cost-sharing reductions, it's not even a debate. A CSR silver plan can pay 73% to 96% of your costs versus bronze's 60% per healthcare.gov. And for someone like a 40-year-old earning around $38,000, that's roughly $1,350 saved in a typical moderate-use year and potentially $17,000 plus over a working life, per health markets estimates. Bronze is only the better fit for the genuine, very low user who doesn't qualify for CSR and wants the rock-bottom premium above all else. Everyone else is usually leaving money on the table with bronze. Here's your clean decision rule. Choose silver if you expect meaningful care in a year, if you want lower deductibles, or, most importantly, if your income qualifies you for cost-sharing reductions. Because bronze never gets them, per healthcare.gov. Choose bronze only if you genuinely rarely use care, and you don't qualify for CSR, and you specifically need the lowest possible monthly premium for cash flow reasons. Log into your marketplace account. Check whether you're offered silver with extra savings, and compare the total cost, premium plus expected out-of-pocket, not the premium alone. Check your marketplace account for that silver with extra savings flag before you renew. It could be worth thousands you're currently leaving behind. Next, I'm breaking down how ACA premium tax credits actually work and the income cliff that can wipe them out overnight. If you want to catch that, subscribe so you don't miss it.